Hello and welcome to the Patient Flow podcast powered by TeleTracking. I'm Suzanne Mayer, and today I'm joined by Lisa Grant, a senior workflow consultant with TeleTracking. And today we're going to be talking about something very near and dear to her heart, this hybrid command center. Lisa, thank you so much for joining us today.
Thank you for having me.
So, COVID-19 changed everything, especially the way we communicate. And remote communication has become more and more commonplace, right?
Right.
So tell me, how has this worked into command centers today?
Well, it gives us the ability to be able to be mobile. Command centers are truly the extension of the hospital. It's where everything happens. But with the COVID, it kind of shut everything down. But with our ability with technology and the ability to be mobile, we could actually take that out to the houses and let people work from home. So we really didn't see a big separation between what we do now prior to COVID and then what we do now. So it actually was really, it helped us to be prepared a little bit more.
How can this hybrid model, this command center model, how can it help to increase revenue for health systems?
Well, the basic thing is it's several things that could help with the revenue. One is that when you're in a command center, you have a lot of monitors, computers, tables, desks, just the physical demand of it when you build a command center. And to be hybrid, you have all that at home. So you don't have to have such a big piece of real estate. And we know if you're in a hospital, real estate is prime. You need that for your patients and everything. And so if you're you have that ability to be mobile, then you don't have to have the bigger space. You can have a lot smaller space. You don't have to have the huge 50-inch monitors all over the wall and have multiple of those, and the desk and all, everything that goes with building a command center.
So research is showing that this hybrid command center model can actually improve the patient experience, the patient caregiver experience. Can you speak to that?
Yeah, we all know, being in a command center, it's usually, you don't have a lot of patient contact. It's more or less that you're kind of behind the scenes doing everything for them. So, it's a very, what I would call a thankless job, because nobody really sees what you're doing, but you are definitely, the first contact when they're calling for that emergent patient or whatever is going on in that hospital. So, to have the ability to work from home, it's customer and, staff satisfaction. You don't have to get up and work 12-hour shifts. You're at home. You can have more of a home balance with your job, as long as you have the ability and you have the means to have that home office where you have some confidentiality and everything going on. I think it's a huge satisfier. The call outs, you don't have the staff retention is not as bad because you don't have the call outs. You can work from home if you still don't feel good, but you don't want to be around it. And I think for, the staff also, it's healthier. You're not around the sick people. You're at home in your own environment, and, you don't have to worry about being in a hospital where, it's all sick people. So, I think it is a true satisfier for both. And I think on the, the client side and everything, you're happier. You're a much happier person. And I think it's a positive.
So you touched on the staff shortages. That's one of the biggest things that healthcare systems are dealing with right now. What are you seeing out there with the hybrid model? And obviously, it does help. What are you seeing?
Well, the staff retention. You have the ability. Like you said, pick your hours. Basically, they usually do work 12 hours, but if I'm at home and they need help, like in a pinch for 6 hours, then I would be more likely to log in than get ready and come down, for everything. And we all know within a command center, there's a lot of moving parts. So when you train, it could take months for them to understand the protocols, everything that goes on within that command center. So, you want to keep those highly critically thinking people in your staff. So, keeping them happy is a big positive.
So I'm a hospital administrator. I'm thinking about making the move to a hybrid. What should I consider?
You really have to consider several things. One is, does the saying, the risk outweigh the benefits? You're going to put them in their home environment. So, you have to think truly about confidentiality. I mean, we're dealing with PHI, so you can't have it laying around. So you have to have a place that is secure. We have the information sitting on our desktops and everything. But you also, you think about everything else that goes on within there. You need to think about the equipment that they're going to need. You have recorded lines. One of our highest recommendations as building a command center is to have recorded lines. Is that possible? Geographically, like I told you a while ago, it's thunderstorming here. So, internet access, everything that you have, do you have that ability that you're not going to be cut off right in the middle of something really important? So, you have to think about all that. But I do think overall, we've gotten so far along with our technology that whatever we see in that command center, we can physically see at home too. It's just the ideal is, is that something you want to do? And a lot of people are doing it.
We've come a long way. Isn't it amazing?
It is.
So great. Well, Lisa, I thank you so much for your time and for sharing this information. We invite the viewers to download the white paper as well as the TeleTracking implementation guide to learn more about launching a hybrid command center. You simply click on the link in our description and we'll take you right there. Until next time, I thank you for joining the Patient Flow podcast, your source for insightful conversations with industry leaders making a difference in patient flow today. Thanks, Lisa.
Thank you.